Okay, so I'm going to start that over. Welcome, everyone, to this month's mental health discussion. We will be discussing African women and strength. Now, back in December, we had Bosala Adenuga, who is a licensed clinician as well as an ADHD coach. And today we have Dr. Shelly Aboagye representing the country of Ghana, who will be joining and helping to facilitate today's discussion. This is a topic that essentially I don't want to suggest isn't discussed, but I would say is not discussed at length. And so that's why we're here. Hold on, let me let this person in. That's why we're here. We are here to talk about the unspoken rules of strength within women of the African community and within the African diaspora. And we're going to go a little bit more into depth as far as what the African diaspora means. And hopefully everyone is comfortable with chiming into this discussion, because again, it's a really important one and one that isn't discussed at length. All right. So kind of already gave intros. If you're not following us, please go ahead and make sure that you are doing that now. So on Instagram, we are Taka757. And on Facebook, we are the Tidewater African Cultural Alliance. Make sure that you follow. We do have membership opportunities as well. So if you're interested in that, you can also check out our website, which is taka757.org. Some quick rules. Just remember that this is a safe space. So keep in mind that if there is any self-disclosure isn't always easy. So if you are going to share and if someone is sharing, just please be mindful of making sure that we are respecting that individual's vulnerable moment. Be mindful of time so that other people have a chance to speak. There's absolutely no obligation to speak. This is an open-ended discussion. There also is no obligation to respond to a question or a statement, even though I will be soliciting that. Please keep your microphone muted if you're not speaking, just so that we can avoid any background noise. No shame-based languages. And if you are triggered by anything that is discussed, please know that it's completely okay to log out, and you can totally log back in if and when you are ready. All right, so our founder and president, Rita Cohen, who also represents Ghana, is not able to join us today. She has an event. She has a couple of events, I think, today. So she will not be here, but wanted to show her face for those who are not familiar. Rita had a vision, and she has done an amazing job of bringing this 501c3 to life. And all I'm going to say is that she is the epitome of someone who is resilient as well as determined. And because of her, we are here today. I myself, the person who's speaking, I am a board member as well as the facilitator for all of our mental health related programs. I am a licensed clinical social worker. I am licensed in Virginia, Rhode Island, and the state of Maryland. And I am the owner of my outpatient practice, I Thrive Therapy and Wellness LLC, which is located here in Chesapeake, Virginia. And today, Dr. Shelly Aboagye. So I'm going to give you a couple of minutes to introduce yourself, tell us what you do for work. And then I'd love for you to tell us a little bit about like how you ended up as an African woman. How did you end up in the area of mental health?
Oh, excellent. Thank you, Natasha. I appreciate this. I appreciate the opportunity to just be here and just talk about this topic because I know it's very, very important. So so what do I do? So I teach, I'm a full-time professor at Marymount University, and I am in the counseling, I teach in the counseling department, and I teach various courses related to mental health. And what brought me to the mental health field is just, experiences. I've witnessed my uncle who's had mental issues when I was a child. And so that kind of sparked my interest to say, I want to learn more about it. And I think my story is kind of similar to a lot of individuals that are in the field anyways. And so just a firsthand witnessing something that traumatic that happened to my uncle, and just thinking about the idea that what is this about? What is behind it? What is the story? And how do we prevent that? So that kind of led me to going straight into counseling. I went to Lincoln and I studied, I majored in psychology. And then from then I just kind of kept going. And I'm here.
Awesome, awesome. Thank you. It's pretty interesting. So for those who don't know, both Shelly and I attended Lincoln University. I don't know if we have any other Lincoln folks in the house, but I think I don't know if psychology was the main reason we met or if it was ISA. But
I
either
say.
way, we were both a part of the African Students Association as well as the psychology club. So thank you for sharing that. And I'm really happy to have you here as well for this very important discussion that, again, just isn't had at length often enough. All right, so let's talk really quickly about the African diaspora. You're going to hear me use that term a lot. I'm pretty sure, for the most part, all of you are probably familiar with it. But in short, those of the African diaspora include anyone of Native African origin living outside of the continent itself, irrespective of their citizenship. So we're talking Afro-Latinos, we're talking Afro-Brazilians, we're talking Panamanians, we're talking Africans who live in Europe, we're talking African Americans, we're talking African Canadians. So, and as we know, we're everywhere, right? So if you are of African descent, even if we are talking 3, 4, 5 generations set, you are a part of the African diaspora. We know that, again, we're everywhere. So I've already mentioned a few places. We can also think of places like Jamaica, St. Lucia, Virgin Islands, Cuba, Colombia, Venezuela, Ecuador, the Dominican Republic. These are places where you can find evidence of the African diaspora. I also think it's important that we really quickly go over the difference between mental health and mental illness. This is something that, unfortunately, and I'm sure Shelly, you would attest to this, both of those things are used interchangeably, but they're actually very different. They do go hand in hand, but they are different. And I do believe that in part because of this, whether it's lack of education or not having full insight, it perpetuates for those of African descent the stigma behind mental health. So mental health is something we all have. There's not a person in this room that doesn't have mental health. You have physical health. You go to your PCP every year, you see your doctors. That's physical health. If you have a mind, you also have mental health. This is basically the place in which is impacted by our experiences, our health issues, workplace stress, community resiliency. That is a part of our mental health, our day-to-day existence within the aspects of our mind. Mental illness is when there is an impairment in our mental health, right? So like I said, we all have physical health, but if you are diagnosed with diabetes, then you have a physical illness. Same thing with mental health and mental illness. We all have mental health, but if there is an impairment in your mood management and biological management, then you have a mental illness. The word illness also is a word that I think most people are uncomfortable with, and that tends to perpetuate the stigma behind mental health or mental health issues or mental health concerns. Most people, when they hear the word illness, nothing good can come of that, right? So I know that growing up, a lot of like the aunties and uncles, when they hear illness and it's attached to the word mental, it's like, whoa, we
Mhm.
don't talk about that. In fact, it doesn't exist, right? So quick examples of mental illness: mood disorders, anxiety disorders, eating disorders, PTSD, schizophrenia, bipolar, so on and so forth. Before we go on, I also do want to stress that everyone struggles with mood impairment. So every person struggles with instances of anxiety, instances of depression or excessive sadness. But when it impairs your ability to function, that's when it becomes a disorder and or illness. So quick icebreaker. This is for everyone who is in the room. If you were to choose an animal that represents your character, what animal would it be? Don't all jump at once. What animal would it be? I'm going to have to think on what mine would be. And you're more than welcome to drop it in the chat as well, if you prefer. I think I guess it would be considered a spirit animal, would be, I don't know, y'all. I probably would have to go with an elephant or a rabbit. An elephant or a rabbit. Rabbits to me are extremely peaceful. Um, they're calm, um, but they can be feisty if necessary. Oh. Anyone else? Let's get one or two more individuals to share. What would your animal of choice to represent who you are be?
Yeah, I think I would go maybe eagle. Oh, somebody say eagle.
Eagle. Oh, so there's two eagles.
Yeah,
Why an eagle? Thank you, Sophie. Why an eagle?
yeah, I want to know.
Why'd you choose eagle, Sophie? Oh, she might be busy right now. How about you, Shelly? Why'd you choose?
So I chose dolphin.
Oh, you chose dolphin.
Um,
Okay.
yeah, I think it's because it's just kind of like very easygoing. Don't want like it's just very highly developed in a way that is that makes sense without being a struggle. And just a little bit of contributing to different things, and not just be stagnant in one situation. So it's almost like Aquarius, like just kind of exuding the energy that doesn't bring too much stress, but you're actively doing something in different places.
I like that. Dolphins are very serene as well. Very, very common.
Mhm.
And then Sophie shared that she chose an eagle because they are loyal and regal. So thank you. Thank you, Sophie.
That's a good one.
Yeah. All right. So first quote of or kind of some information for the day. Social stigma has meant that in much of Africa, mental illness is a hidden issue equated to a silent epidemic. Many households with mentally ill persons hide them for fear of discrimination and ostracism from their communities. Girls from homes known to have mental illnesses are disadvantaged due to the fact that a history of mental illness severely reduces their marriage prospects. This is from Mary Niamongo of Nairobi, Kenya, from the article, The Social and Cultural Aspects of Mental Health in African Societies. So first, I'd like to ask you, Shelly, in the part that I italicized very intentionally, that due to the fact that a history of mental illness severely reduces their marriage prospects, can you talk a little bit on that and why that is? And then we'll go from there. Why does mental illness reduce an African child, African girl, African woman's basically pool of men that she could choose from?
Yeah, no, very good question. And this actually came up the last time I did a session with a client who's from Rhonda, Rhonda, and she has bipolar disorder. And so one of the things that she was struggling with was the the lack of education and not wanted and what bipolar or any kind of mental health is attached to. And so oftentimes individual like men or anybody typically attach mental health to someone who is struggling with their day-to-day lives, and that will impact the relationship. And so somebody coming in who lacks that level of education, it's saying, I'm going to have to take on that responsibility to be able to consistently empower this woman.
Mm.
And that kind of puts a little strain on them because then now they have to think twice, do I want to put myself in that situation or not? But that doesn't necessarily have to be that case, because there's so many different ways to handle that personally without involving anybody else's. So a lot of men that lacks that kind of education will often think about that, as far as, am I going to be this person's strength? Am I going to have to be um, I might have to do more work for this person than going somewhere else that I wouldn't have to do that.
Right, right. Thank you for that. Is there anything to be said within our African and Caribbean cultures about how if you are to marry into a family where mental health issues are are known to be, that somehow you're inviting that into your own life, right? That if you marry someone with schizophrenia, your
Mhm.
kids are absolutely going to have schizophrenia. Or if you know, marry someone with a mood disorder, that somehow your life is going to be miserable. Can you
Mhm.
speak to that a little bit?
Yeah. And I hear this a lot where a lot of couples would or those who are in a relationship would say, I let's do genetic tests, or they will ask certain questions, which is appropriate. But but is just the idea of what mental health is. Like if somebody has schizophrenia, it's a list of things that comes into it, and not just the individual, but we're talking about generations to come. Do we want to put ourselves in that kind of situation? Are we going to be constantly having to worry about this, not only the person who's in the family, but if we have kids, this is going to be the same struggle
Mhm.
ongoing. And are we going to have a healthy lineage, in the future? And so obviously that kind of puts a little bit of issue in like when it comes to who are you bringing to the house, and who are they as a whole? Are they well enough to be a part of the family? And how are we going to handle that moving forward? If the person has some level of illness, we're not sure. We need to look into that a little bit more, because it's one thing to just deal with that person one on one, but then if having kids and having to deal with that, can be a struggle, for
So
some family members.
you just said something that I heard, and if anyone else who is in the Zoom right now can drop or kind of just do the whole emoji raise hand. I heard a lot growing up, for others. You would
Mhm,
hear those who, were, looking for a partner, or their mom is like, listen, you need to get married because you're
mhm,
almost 30. And if they bring someone, that was the question, are they well enough?
mhm,
I think for the
mhm.
most part, what they really mean is, do they have a major physical ailment and or any mental ailment,
Yeah,
right?
yeah.
But I think what's one of the things that I want to highlight here is that within our cultures, we somehow believe that any kind of illness automatically means that that person isn't worthy
Mhm,
of being loved, that person isn't worthy of being married,
yeah,
or that there can't modifications can't be made in conjunction with love for that person to
mhm,
have a well enough life, just like their counterparts. And that if you do happen to have bipolar, then you almost have to choose someone else who has a mental illness because you do, if that makes sense.
yep, absolutely, absolutely. Yeah, it's almost like let's just take the easy way out. We don't want to have to deal with the consequences
Mhm.
of this illness. So,
Absolutely. All right, Shelly, Dr. Shelly, can you share a little bit with us? What is trauma? We use that word so much in today's time. I'm often telling my clients that we have to be mindful as well with how most of the words are overused, some words are underused. But if you could share with us this afternoon, what is trauma and how does
yes,
it affect a person?
yes. So trauma is, I think when we think about trauma, and I just taught this in my class, is we look at the bigger picture. Oh my goodness, we just jump straight to whether the person is sexually abused, physically abused, those kind of heavy hitters,
Mhm.
which is rightfully so, because trauma is a heavy word. It comes with so much, but but in essence, trauma can be little things that kind of happens throughout your daily lives, that accumulate, and it just becomes a trauma ultimately. So sometimes we discount what trauma can be. So trauma is basically something that happens, that's like a life change and experience that happens when individuals, that shapes their perception of life, their that also not just the perception of life, but also impacts the way that they make decisions. They impact their ultimate view about humankind.
Mhm.
um, and so that's what trauma means to me. But obviously it comes with different definitions. I don't know if
Yeah.
that makes up the big word.
No, I mean, that's pretty much the bulk of it. And I think the most important aspect of that definition that you provided is it affects the person's outlook on life and how they make decisions. And I think one of the biggest misconceptions about traumatic events is that let's take a car accident, right?
Mhm, mhm,
If you and I get into a car accident and it impacts how you view being on the road after that, it was a traumatic experience for you. You're afraid to get behind the wheel, you're afraid to get on the highway. Maybe the next week I was back behind the wheel, I was driving that car, and people don't understand. And so people start to judge you and say, well, that wasn't
mhm.
traumatic because Natasha was able to get behind the
Yeah.
wheel. The
Mhm,
biggest and most important part of the definition of trauma is how it impacts the person. So
mm.
two people can go through two very similar
Yep,
instances and have two very different outcomes.
yep,
It doesn't mean that it was traumatic for both individuals, but it may have been a traumatic event. But again, more importantly, it's how it affects that person's outlook on life and how they make decisions.
yep.
So let's go over a couple of different, types of trauma that are extremely prevalent within the African diaspora as well as on the continent itself. So in South Africa, one of the most prevalent types of trauma is witnessing violence or violence itself. That can mean domestic violence, that can mean just physical violence, gender on gender, colleague on colleague, things like that. In the Democratic Republic of Congo, the most prevalent type of trauma is high community conflict or war, so the perpetration of violence. When it comes to, let's say, Grenada, the most prevalent type of trauma is physical and sexual abuse. In Haiti, the most prevalent type of trauma are natural disasters, such as earthquakes. In Trinidad and Tobago, the most prevalent type of trauma is psychological trauma, also known as domestic violence or emotional abuse. Some of the most common mental health disorders. So I know growing up, and drop in the chat if you had this experience. I know growing up, I was told Caribbean, African people, we don't have mental health issues. We just don't. And it used to confuse me because I would see individuals, I would observe individuals who evidently had some deficits, whether it's an emotional deficit, a cognitive deficit. And I couldn't understand why, the narrative was that we didn't struggle with it. And then also, if we're human, everyone struggles with mental health. You don't have to have a mental illness to struggle with your mental health. And it was one of the reasons that I was extremely intrigued by human behavior. So based on what we just went over as far as the most prevalent types of trauma within Africa as well as outside of the continent, it makes sense when much of Africa has experienced war,
Mhm,
when
mhm,
domestic violence is extremely common, when community violence is extremely common, when you are a resident of an island that is repeatedly hit by earthquakes, it makes sense that PTSD, somatization, as well as depression and anxiety disorders are the most common. And for those who are not familiar with somatization or somatoform disorder, that basically is when a person has a hyperfocus or hypervigilance on physical symptoms. So a person who is constantly going back to the doctor because I have a headache or I have a stomach ache or I have all of these physical, sorry about that. I have all of these physical health issues, but there's no answer as to why. And it's probably because of an environmental stressor, whether it's stress at work, or it's a very toxic relationship that is causing you to have now these physical symptoms that no medical professional can categorize under a particular title or illness. All right, so first discussion, Dr. Shelly Aboagye, as a Ghanaian African woman, how do you genuinely, how do you define strong or strength?
Oh,
And
yes.
do you live up to that definition?
Okay. Whew. Heavy loaded. It's like heavy loaded potatoes. I maybe because I'm hungry. But anyway. But so how do I define strength? I think three words that comes to mind is um proud, perseverance, and resilience. So those are three things that kind of stands out to me when I hear the word strength. It's just the ability to go through so many challenges.
Oh, oh, she accidentally got booted out. All right, here's what we'll do until she comes back in. I'll go ahead and share my definition of strength. And for those of you who are on, can you go ahead and drop in the chat if you're able to how you define strength? So as you all do that, my definition of strength is essentially one's capacity to find the tools that will help you endure or work through or navigate or basically manage a very difficult situation. I'm a true believer, and I've seen evidence of the fact that strength looks different every single day, and that looking strong isn't actually strength. Looking strong can be a facade. Looking strong can be what you feel like you need to do because you're in survival mode. And then strength also is presented differently from person to person. So for someone who may be extremely tearful, who cries a lot, that could be a symptom of strength for them because their ability to release the toxins without really caring if they're going to be judged for it. And then you have individuals where maybe that's not the way that they show strength. Maybe they show strength through their ability to effectively communicate what their needs are and what tools that they need to again navigate that difficult situation. Welcome back, Shelly. You're still on mute. Let's see. There we go. Still on mute. There we go.
Okay, sorry.
Okay.
I don't know what happened. I apologize. All right. Can you guys see me?
Yes.
Okay, awesome. So that question. Wow. So like I mentioned earlier, perseverance, courage, being proud of your history, some things that you've gone through that you're able to kind of resiliently come out of it. And so I'm sorry, that the whole thing just kind of threw me off because I was I'm trying to build myself back up. So please bear with me. Um, and some of the things that also came to mind was we are so consumed with helping others and depleting ourselves because it's important because as growing up, and I can't speak for everyone, I can only speak for myself, my own personal background. And so growing up and what I've witnessed from my mom, my grandmother, and the powerful woman in my community, they it's just you cannot be selfish. You had to be selfless. And so that means that being just kind of giving back, doing from the outside, helping this person and making sure that this person is okay and everybody else around you, but then you're suffering in silence, which kind of connects to our topic. Because then you go home and then your level of anxiety has been heightened a little bit. You're slightly depressed because you're internalizing these things behind closed doors. But then on the outside, you're being portrayed to be strong, and it's a perception about others, and not necessarily your perception about yourself. So those two things can clash. How do you give yourself out so much and then still focus on yourself? And the reality is you're not going to be able to focus on yourself because a lot of time has been given to others and to the community and to the world. And so that can bring a lot of anxiety, social anxiety to us, so it's like conflict and it kind of like clashes with each other, where you're you're anxious. And what that means is that you're out there, you're putting so much because you're afraid that others might look at you differently. And so you're putting so much out because if not, you're going to be socially anxious. Does that make sense?
It does. Socially anxious. And I think it's safe to say that within many of our African cultures and Caribbean cultures, and even within the African American culture, that is not something that we aim for, right? Because for the most part, we are a community-based or community oriented, family oriented culture. And so being socially anxious means you're making all of us look like we're socially anxious. It's not just you, right? Or, being depressed, you have nothing to be depressed about because now everyone else is going to think, well, what are we doing? How are we treating you? And we're giving you everything that you need. So the idea of strong or strength, I think it's safe to say that within our cultures, it's really about how you present on the outside and not necessarily about what's going on internally. So like you said, we internalize a lot of these emotional health deficits and even physical health, but you have to present as strong because of the community, right? And that's another way of being selfless and not taking care of yourself.
Yeah.
So we dropped in a chat, but her definition of strength is courage, endurance, and being able to do what's necessary when needed. Thank you. Thank you. All right. So what is it about Ghanaian, African, Caribbean cultures that perpetuates an obsessiveness with strength? In other words, why are we so obsessed with being seen as put together, strong, smart? And if you're not a doctor, lawyer, one of the five, as we all know it to be, then somehow you have not lived out strength. Because I even know someone personally whose father told him that he was weak because he's a medical doctor and his son decided to go for pharmacy.
Okay.
It's described as weak for not taking the more strenuous career because of this obsessiveness with strength and how, we're being portrayed. So what is it about our cultures that perpetuates this?
And actually, with this question, because we can address this question without going all the way back to our childhood and some of the things that we experienced as children. I know, for example, with me, there's certain things that I'm not able to do, and that as a child, like certain things I wasn't able to do as a child. For example, my grandmother would tell me, you can't play with boys, you can't do certain things, you can't do this, you can't do that. And it's just the what has been instilled in you of the definition of being strong, being a strong woman. And so I know that there was a time where I had my menstrual cycle and I was going through so much pain. And till today, it still kind of rings in my head. My mom was like, you cannot show your pain just because you're having cramps. You can't show that. You have to be able to deal with that. You can't show that on your face. You cannot make any movement that indicates that you're weak. Yeah. And so that's something that I had to break out of, because I was like, well, I'm not a warrior. I'm not Yas Antua from, so who's carrying the sword. And I have my vulnerabilities, and being strong doesn't necessarily mean that you have to be, you have to be aggressive. You have to be doing all these kind of things. But it just simply means that you have a helping hand. You're able to help your community. What are you doing that makes you happy, that brings strength, not for yourself, but to be able to be strong enough to be able to help others, and empower them to show their vulnerability, and not necessarily what we're being perpetrated as Black individuals or Black women are being perpetrated to what strong Black woman or strong African woman looks like. Because typically what the stereotype is that if you're strong, that means that you have to be controlling, you have to be very loud and aggressive, right? But then when in essence, when you're not strong, when you actually pull back a little bit, they're like, oh, you're not assertive enough, you're not, you're just there, you just exist. So it's just they just pulling us from two different directions. But and I think that goes all the way back to how our mothers or our parents were parented, and it just kind of trickled down to us, the obsession of being strong, as a woman. And again, it starts all the way for when as a child. And the way that they're raising you is how they were raised. And it just kind of it's becoming a cycle.
Generational.
It's a generational cycle. Yeah.
So I want to suggest something, and I'd love for the rest of you guys to share your thoughts or to drop it in the chat. I would suggest that maybe it's not even necessarily an obsessiveness with strength, but it's an obsessiveness with being accepted. And I think this can even go back all the way to colonialism, as well as slavery, so on and so forth. We want to be accepted. So what the dichotomy that you were just describing, Shelly, kind of sounds like you have to be strong, but don't be too strong, right? Don't be too strong, because if you're too strong, then at that point, you're not going to be able to have a husband. You're not going to find a husband if you're too strong, right? And if you're too strong, you won't be able to get a job, or no one's going to want to be around you. But you have to be assertive enough to make sure that you keep that job. And that's exhausting, right? That whole strong Black woman idea. So I would suggest that we probably have an obsessiveness of being accepted versus strength, but it's masked as strength. If that makes some sense. I'm going to be very honest. And a lot of my clients are of African descent, whether it's first generation, second, third generation, or they migrated to the United States. And a lot of my clients are Filipino. And it's the same story. If I tell my parents how I really feel, it's going to make them uncomfortable. And they're probably going to act like I never told them in the first place.
Yeah.
And then that perpetuates this idea that I have to internalize it. I have to keep it within myself. And then one of two things happens. Some people are resilient in a way where they can continue to internalize that and function, but they're going to crash at some point. And other individuals crash, quote unquote, right away. And that can look like a number of things: a panic attack, situational depression, seasonal depression, all of those things. But because we want to be accepted in a man's home. We want to be accepted by our parents. We want to be accepted by that boss. We want to be accepted by society. You can't be in a certain career because people won't accept you. You can't be this because they won't accept you in the church. And that need and obsessiveness for acceptance forces us to put on a strength that many of us don't have the strength to actually exercise.
Yeah, and I love what you said, because oftentimes we do certain things, or we have to exude the strength, not based on what, because we might be tired. We are tired, but then we're doing this to not bring shame to our family, to not bring shame to our community. We're doing it because, and we're not doing it necessarily doing it for ourselves. It's just more like out of body kind of reaction to these things. That also brings a lot of trauma. That brings a lot of it puts a lot of strain in your mind, and so it's just not a healthy way of. We have to be balanced, show strength, but also kind of being yourself and being
vulnerable. It's a healthy balance. Thank you, Valerie. So she shared in the chat that I think white supremacy may have something to do with the example about the career. I think the idea of being a doctor, lawyer, engineer, etc., part of the five, shows you that you have money. Yes, that you're hardworking, and thus you can escape the stereotype of laziness.
Yes.
Yeah. That has been put on Black people. This is something that I think Africans in the diaspora may not realize stuck with us from colonialism. Absolutely. I mean,
100%.
Yeah, 100%. It is a generational way of thinking that has passed on, and it's been passed on for so long that we don't recognize it any longer. But you're absolutely right, because that word lazy, you're spot on, Valerie. I think most of us, who grew up in maybe what we could call a typical African home, has heard that time and time again. You cannot be seen as lazy.
Absolutely.
You cannot be seen as lazy. There's never, you rarely hear talk about rest.
Oh no, you can't rest.
To lazy.
Yeah.
Right. And there are certain careers that we associate with lazy. Unfortunately, I do believe we're starting to grow out of it quite well. But there are still many of us who are stuck in the idea that if you're not one of the five, the doctor, engineer, the lawyer, so on, that you're lazy. Why'd you go be a psychologist? Why would you go be a therapist, right?
What is that?
Unless you can prove that you'd be financially stable.
Absolutely.
That's usually what changes someone's
Mhm.
mind. Not do you
Absolutely.
enjoy the career, not is the career fulfilling, not is this your calling,
Mhm.
right?
Yeah.
Thank you for
I
that.
don't think we have a word for self-care. I think the self-care doesn't really exist in in the African because and just like Valerie said, it just means that you're not doing anything. Oh my
Mhm.
gosh. Wait, are you just laying around? No,
Mhm.
you're supposed to be so not doing anything to take care of yourself is typically equate to laziness, but then that goes all the way back to colonialism, and just like I was saying. And I think Malali Lily also said something.
Yeah, so thank you for dropping that, Lily. Lily, she says, just being Black, we have to work 10 times harder than everyone else to prove that we are not weak, not lazy, etc. I mean, I think we can all agree. And I love the fact that we are entering the era of it's okay, right? It's okay to rest. I think that physically we're starting to recognize it's okay to rest, but I think we still grapple with it up here. I know that I still struggle with it, right? I may have worked 14 hours that day and I'm struggling with, but I really should clean that kitchen, right? Or I really
Mhm.
should pick up after my son. I really should do this because if I don't, even though no one is looking at me, it feels like people are looking at
Yeah,
me.
sure.
It feels like people, it feels like someone is going to tell me that I'm
Mhm.
not doing the 100 million things that I
Yeah.
don't necessarily have to do to be a quote unquote strong or
Mhm.
resilient, human being.
Absolutely. Absolutely.
Thank you for sharing those thoughts, ladies. So, emotions as a female child, were they okay to show or were they kept within the family? And Dr. Shelley, you already shared a little bit about that from your experience when you were younger, being on your cycle, and
Mhm.
the physical pain that we know for many of us comes with having your menstrual cycle. And you were told not to, you're not allowed to show that pain.
Yeah.
So can you speak on any other emotions that we couldn't, like you just don't show that. You
Mhm.
don't let the world know that you're experiencing it.
Yeah. No, 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 that's a great question because while I make that example, I also thought about something that was like pretty recent. I know when my dad passed in 2020, there was a time where in the funeral when we're going to the viewing, my mom and some of my aunties they pulled me to the side. They didn't pull my brothers to the side, but they pulled me to the side and they said, "I don't want you crying out loud."
Whoa.
Just yes, just go in there. Yeah, don't cry out loud. It just doesn't make you look good. Just kind of just cry in a very poised way and just wipe your tears. Not don't show too much tears because it's gonna ruin your makeup. Just I was just prepped on this by three of my aunties and my mother, and they literally and then my brother was like, "You can cry however you want. It's okay to do that," and so that part of emotion was kind of like stripped away from me, and I had to literally go home and just burst out and do it because I couldn't do it in public. So these are some of the things that again based on how they were raised and how what emotions look like for them does that and of course like whatever you do represent them as well, and so you had to they have to prep you to make sure that you don't put them into shame, and it's very it's deep, it's so many layers to this, and I know we have these kind of conversations, but hopefully at some point be able to break these barriers that affects us in our day-to-day lives. Yeah,
Mm, that is deep. That is very
yeah.
deep. As you said that, a thought that came to my mind was if you were to cry outwardly or cry dramatically, let's
Hmm.
just say, is essentially what they were asking you not to do, then you were not being strong enough.
Hmm.
But the message they were also telling you is internalize it, pretend like you're not sad,
Exactly.
minimize your sadness, and that is
Mhm.
strength.
Mhm.
That is
Exactly.
strength. But I can imagine that if you didn't cry at all,
Hmm.
that would
It'd be
also be
different.
seen as strength.
Exactly.
So
Exactly.
that again, that dichotomy of you're doing too much
Hmm.
and you're not doing enough
Hmm.
constantly is a state of survival of am I doing enough? Am I doing too much? Am I too aggressive? Am I not aggressive enough? Being in that chronic state create these anxieties and depressions, whether it's seasonal or situational or it's chronic. And that is something that as a culture we don't understand. Thank you for sharing that. So on this slide, I have Tonto Dike. She is a Nigerian, very popular Nigerian actress, 35 years old, and she reports that she battled with depression several years back and actually also contemplated suicide. Tonto shares that she decided to start therapy and has since been able to overcome her depression. Did you know that in the National Study of American Life, individuals of African descent within the United States, to include Caribbean Blacks, report a lower current and lower lifetime rates of struggling with major depression than their Caucasian counterparts? However, when a Black individual is suffering from depression, both groups were more likely than white individuals to be chronically or persistently depressed, have more severe symptoms, higher levels of impairment, and not receive treatment. So in short, individuals of African descent are less likely to report experiences with depression, anxiety. However, when we do, it is so chronic and so persistent that it's kind of like it goes downhill from there. And I think that it's safe to say, I mean, studies show it, that the data is there. It's safe to say that it's because of all of that internalizing. It's because we've been taught you don't cry outwardly. It's because we've been taught it is always community over individual. We've always been taught you be selfless over selfish. And that chronic way of dealing with our emotions, when we finally hit that threshold, the symptoms become chronic. Any thoughts to that, Dr. Shelly?
Yeah, no, and I definitely agree because and I think that there was a question that's kind of connected to this, but typically from what I've seen, I know that Natasha, you've seen this as well, that individuals will come to therapy not after so many issues that they've been dealing with, and it's like you almost have to hit your rock bottom in order to know that you need help when these things can be prevented earlier. And I think it comes to societal, like the stigma and the societal pressure to say you're okay. Can you still work? Are you able to take care of your family? If you're able to do these things, typically ask you 2 or 3 different questions. And if you pass these questions, you don't need no, you're okay. There's nothing wrong with you, right? Are you getting money? Can you feed yourself? Do you have a home? Do you have a family? Okay, you're fine. And so then just kind of not taking the effort to say, no, I'm not okay. Even though I'm doing these things, I'm still impacted emotionally. Like internally, I'm suffering. Typically they wouldn't get the help they want until they are absolutely at a place where they either hearing voices or like it's been triggered by so many different different things. So that's when they feel like, you know what, I'm at my rock bottom. Let me go get help. Because at this point, they feel like there's nothing they can do anymore. They have to accept the fact that they have gotten to that place, and now they're going to put their hands in somebody else's. They're going to put their life in somebody else's hands to help them in that situation.
Yeah. Patricia in the audience said that, that is so true. That's what I see in my practice as well. And this is general across the board for all human beings. But, within our cultures, yeah, it's not until you hit rock bottom. Something that I've consistently heard, and this tends to go for my Hispanic, Asian, and African clients, and my African American clients, is that, well, my mom didn't go to therapy. My mom was struggling, but she still got it done. My mom was tired, but she still went to work. She still cooked every night. She still did all of these things. So there's this fear of appearing lazy if you go and seek that help because, well, my mom did it, but your mom wasn't happy. And one of the things that I try to kind of show the connection is, you're right. Your mom did do it. You're absolutely right. Your mom did everything under the sun from sunup to sundown, and she was sick, but she hid it. And that's what she has taught you to do, to hide it. but you've hit rock bottom and you no longer can. And that's why we're here. So let's start your journey.
Absolutely. Very powerful.
All right. Why doesn't the average African Caribbean individual believe in therapy? What is that?
And it's so funny because when you asked me the question, the previous question, I connected to this one because it's just the stigma. Why do you need to put your business out there? Do you have families that can help you get through these things? Why do you want to go and spend money and talk to someone you don't even know, someone that you don't know if they care about you or not? Our business, your business is out there, and I've gotten that so many times when I told my family that I was going to therapy, they're like, therapy? Why? How much is it? Do you know this person? Oh my gosh, no. Like, why am I not? And then now they feel guilty because they feel like you're not, you don't want to come and talk to me. Am I not available for you? And now it's about them, where they feel like they failed you, that you have to go somewhere else to get the help. And especially when I spoke to my auntie about it, it was just taboo. Like, she was like, you can always call me. Have I not made myself available? My goodness, you can talk to me about anything. You don't have to go talk to somebody else. And whether I mean, this is just my personal story. I'm sure others have gotten different versions of it, but typically, what I've heard is, I know I did a workshop for African women empowerment for battered African women who's in America and they're trying to figure out what they can do outside of their husband. And one of the things that they were afraid to come to seek therapy was, like the stigma and to tell the world that you're not able to handle things on your own, to figure things on
Can I
your own.
interrupt you there
Yeah.
really quickly? So when you say that the idea is you're not able to handle things on your own, that is strength, the ability. But it's such an oxymoron, right? Because we come from such a community and family oriented culture, but yet you're supposed to handle your pain on your own. I just wanted to throw that part out there.
Yep. And I love that. Just got the goosebumps. But yeah, so it's very, very, it's such a confusing time we live in. And I think recently folks are becoming more and more open to the idea because a lot of churches are talking about these things, where in the church, you couldn't talk about mental health because mental health is concerned in the African community, as we all know. It's the extreme emotional impact. So that means that there are external forces that is unnatural for an individual. So if you have any mental illness, that means that something is attacking you that's demonic, right? And so we don't want to connect ourselves to that. And so so we were looking at you from a different perspective. And obviously that puts a lot of emotional turmoil in individuals that can be open about what they're struggling with and possibly seeking help. And so, and it's twofold. If you tell your family that, hey, I've been diagnosed with personality disorders, oh my gosh, the evils are attacking you. The folks back home are doing something to you, or whatever it is, right? It must be one of your aunties and your uncles taking you to the witchcraft, whatever. I don't know, but these things are, that what typically comes up. And so, based on what you know about your family background, I think the stigma that's attached to mental health and simply going to therapy is so heavy that nobody, like, we don't want to talk about it. We don't want to hear it. Let's deal with this within the family. Let's keep everything within the family, and
That
we're
is
going to
so
be okay.
valid. Let's keep it within the family. Let's keep it within the house. But unfortunately, more times than not, that is the very reason sexual abuse continues.
Absolutely.
That is the very reason emotional and physical abuse continues. It's because it's kept within the family. So we're not going to go out there and tell a stranger who, sure, we don't know if they care about you or not, but they're unbiased. They don't have any obligations to what's going on in your family except for what's going on with you. So they're more likely to give you an unbiased response, unlike your family.
you.
So the idea that therapy is not a good idea is also what perpetuates the stigma. Yeah, I mean, that's what I'll say to it now, because I feel like that's another big conversation within itself. Val said, I completely agree with you, Shelly. I also wonder how much of the fear of vulnerability has to do with it. In my own personal experience, I was terrified of opening up to someone because I struggle finding the words to talk about how I feel. And that is because I did not see it in my household. Do you ladies see it with your other patients? 100%. I have clients who come in and they'll just look at me. They're like, I don't know. I just know that I'm sad and I'm not eating and I'm not sleeping, but I don't know what's wrong. And it can take months to build up to their capacity to be able to verbalize it themselves. But that's when you know that it's really working. It takes a while. And I say that because if you've lived a particular way for 15, 20, 30, 40, 65 years, and then you start coming to therapy, of course, you're not going to know the language. Forget what social media tells you and all of the gurus out there. You're not going to know the language, or you're not going to be accepting of the language because it's foreign to you. But yeah, I absolutely do see it with my patients for sure.
And I'm gonna actually connect it to myself too. I remember, as much as I've taught, I taught psychology one. I mean, what is it? Counseling 101 for individuals who are going into the counseling field, and I talk about how it's important to talk about your feelings, your emotion, expressing all these different terms that are so fancy. And then when it was time for me to my first day in therapy, Natasha, I did the same exact thing that your patient did. I was like, hi, I'm here. What do you have for me? You know, my train and everything just went out the door because now I have to talk about myself. And that's a scary thing, right? To be able to, I didn't have to let language, and just like Valerie said, I didn't have the language to connect it to my emotion because it's so disconnected, that you live this way, but then you don't connect it to your feeling. You don't have time to feel. You don't have time to, to think about how you're feeling and how that's impacting you.
Yeah,
Because then that makes you weak.
that's a good point. You don't have time to feel. And then I'll also add, sometimes you do know the language, but you've never been given permission.
That's right.
And so when you finally have that permission, it feels foreign, or you feel like, yeah, I don't know about this. I know I want to, but I'm not too sure how I actually feel about this. And it can take a while. Some individuals, they come in, they're like, I don't know what's going on with me. Fix me. And the first thing I say is there's no such thing as fixing a human being, because if you genuinely believe that you're fixed, you're never going to be. There's nothing to fix, but there is a human that we can mend, that we can remold, that we can revamp into a version of yourself that you genuinely believe will bring you a sense of joy. But fixing, the idea of fixing means that you are shattered into so many pieces. And that's probably something that also roots from childhood. The repetition of there's no time to talk about your feelings. And then, like you said, your auntie said, am I not here for you? But when they open the door, as soon as you open your feelings, it's like, how dare you feel that way?
Exactly.
Right. And you better not talk back.
Right. Exactly.
So that's where the conversation ends. Right? Be strong, get it together. You're a woman. Let's keep going. So just because of time, and I want to make sure I'm respecting everyone's time, let's move on to this quote, and then we'll do the last couple of slides. So in the mental health, there's an article from the Mental Health in Bahamas written in 2021, and I pulled this quote that says, poverty and shaming are the leading causes of depression in our country. Poverty and shaming. Just keep that in mind. Poverty, we all know that poverty can be an antecedent for mental health disabilities, and we know that shaming perpetuates the symptoms of mental health disabilities. All right, let's do this one. So Dr. Shelly, can you share, as Africans outside of the continent, so in America, the Caribbean, South America, Europe, are we losing our strength? Are we losing our culture somehow by opening up and doing therapy, by becoming mental health professionals, by crying dramatically, by taking a break? Are we somehow losing our strength, aka our culture?
Right. No, that's good. It's a very, very good question. I think it's one of my favorite questions actually, because I mean, I think like the answer to that is no. Actually, I think we're building more strength because our definition of strength actually hasn't been working. So now we're shifting the paradigm shift is happening where we're able to kind of challenge what what has been instilled in us and breaking those barriers and breaking those uh, um, what is it the trauma, to be able to say we no longer want to be a victim of that anymore, that we can actually break free and get the help that we need for our generation to come. We want to prepare our offsprings and those who are to come before us to say, hey, you guys would deal with what you need to deal with when in your generation, but now we've realized that we've seen you suffer in silence, and we no longer want to take on that anymore. That we're moving into in a direction that's productive, in a direction that is feeding us the strength of what we need to do to keep pushing forward and empowering our community, our individual community, to be able to do what is important for us.
Yeah.
So yeah, so I personally think that our generation is so powerful that we are emerging from the ashes to say
I
we're
like
here, we have a right.
emerge from the ashes. I like that. In other words, what I think I hear you say is that, we're no longer choosing to be in survival mode. We get it. That's how you were raised. That's how your grandma was raised, so on and so forth. And, and I'm not going to sit here and dispute that there are not benefits, right, of getting up and getting things done.
Mhm.
No one is saying that at times that is not necessary. We know that it is. But if you live the entirety of your life that way, you are going to end up with a chronic illness. Sometimes it's mental, sometimes it's physical.
Mhm.
We know that chronic stress leads to ulcers,
Mhm.
but we don't shame anyone for having an ulcer. We
Exactly.
know that chronic stress leads to pervasive migraines. But chronic stress also leads to sometimes anxiety related disorders, OCD, anxiety, social anxiety. But those are the ones that we happen to shame. And then, as you know, it typically, as human beings, of course, it's a bit harder to understand something you can't always see, right? You can see when someone has an unhealthy leg. You can see if someone's going through treatment for something. But a lot of times you can't see depression,
Mhm.
especially
Mhm.
if you've been taught to be
Yeah.
strong.
Yeah.
And so if you can't see it, somehow it's not real,
Doesn't exist. Yeah.
doesn't
Absolutely.
exist, right? All right, final tip. Can you share with us what tips you have for those on the continent or within the African diaspora who desperately want to live differently from how they were raised?
Oh, tips. Yes, I love it. I think it's just by just you guys being here, it's like it's the start of it all. Just logging in and listening to this conversation and being a part of this conversation is important because um what is it? knowledge comes with Knowledge comes with information. And so without the information, you just don't know, you might not know what to do, which direction to go to. And so it's just the idea that you know what you need to do to be successful and to live a quality lifestyle. For me, I promote quality lifestyle. What being living a wellness, a life that you can look back and say, I've lived, and I'm very, very proud of what I've learned, what I've gained, and what the future is looking like for me. To be able to kind of like let's leave something behind that you're proud of, despite your struggles, despite your adversities, and to kind of breaking out of it and being successful. And so some of the tip is to be stay true to yourself, acknowledge that you are not that something is off, that something doesn't sit right with you. And because we do have the instinct, and so if something doesn't sit right with you, it's important that you explore what it is that you need to do to be able to balance yourself, to feel connected and to be congruent with yourself, which I think is very, very important and it's powerful, because once you get there, you know that you have control over things that you didn't have control over. You don't have to accept certain things that you didn't have control over. You have the right to make changes and not just accept it. And so I think we have the armor and the shield to do these kind of things. And I love our generation, because I'm sure back in the day they didn't have the platform to have these kind of conversations. But here we are just talking about things that has been hurting our family, has been hurting the past generation, and we want to do better for our next generation to come. So yeah, so these are the tips. No, like being don't accept things that doesn't feel right, but yet making changes, recognizing that there's change that needs to be made, to not for yourself but for others.
For sure. Thank you. Thank you so much for that. I think the only other thing that I would add is, well, two things actually. The first one is therapy or seeking or engaging in practices that encourage your mental wellness doesn't only have to be when things are feeling bad.
Right.
Be proactive. Start now. I tell clients who are like, well, I don't really, I'm like, listen, if nothing major is going on in your life currently, maintain some sort of therapeutic practice, even if it's intermittent, because then you are being proactive and decreasing the likelihood of you having another crash.
Sure. Yeah.
Don't wait until that before you seek some sort of help. And then the second thing is, we are giving you permission. So for any of you who are in the room today who are wondering about therapy, or you've already started therapy, but you're not as open as maybe you'd like to be, we're giving you permission. And it's not even just talk therapy. There's all kinds of therapies. All right. It's not just psychotherapy, but we're giving you permission. Lastly, look for someone, if it's necessary, it's not always necessary, but look for someone who you feel like can share some of the familiarities that you have. And so what I mean by that is, you might need to look for a Black woman. You may need to look for an African woman. You may need to look for a Caribbean therapist. You may need to just look for a woman therapist. You may need to look for a therapist who's from the South. You may need to look for a therapist who has lived overseas at some point in their life. Whatever it may be, they don't have to be Black. That's not always a criteria, but has some sort of familiar space within them that you can relate to. And the reason is, if you don't, you are more likely to be triggered than you are to feel supported, because you may walk into that space, and even though it's not what the therapist is doing, you may receive it as, well, that's what my mom would tell me. Right? So by having someone who has some of those familiarities, you will feel a bit of a sense of comfort. And even if they're challenging your way of thinking, you're more likely to receive it.
Absolutely. I love that.
My tip for you all. And then lastly, tips for embracing culture. And actually that was from a prior slide, so we're going to ignore that. But thank you for everyone who joined this afternoon. Dr. Shelly Aboagye, I am so grateful for you. Thank you. Thank you. Our next one is taking place May 27th, also virtually. And then we are having an even larger one during Minority Mental Health Awareness Month in July. So you all take care. Go be great.
Guys.
Take care of yourself. Rest is okay. If you haven't found a therapist, keep looking. Drink your water.
And rest is not being lazy.
Thank you, everyone.